Assalamu alaikum. Sorry to start this session late. We will do a short session, only one communication, and the case is about Mrs. Lisa, 27 years, known to have insulin-dependent diabetes mellitus for the last 20 years. She is strictly controlling her blood sugar level by 3 doses of regular insulin and 1 dose of basal insulin every day. She suffered from multiple hypoglycemic attacks in the last 3 months that led to suspension of her driving license, which made her angry. Last hypoglycemic attack was 3 days ago. She was brought to the hospital in convulsion. You are the medical senior house officer in the endocrine unit on duty. Today, your task is to sit with Mrs. Lisa, discuss her causes and complications of her hypoglycemic attacks, how to avoid these attacks, and address her concern. We'll take 1 minute and Dr. Mahmoud will start. Tell me when you're ready, Dr. Mahmoud. Okay, we start after the timer. You can see the timer now.
Yes.
Yes, let's start.
Hello, my name is Dr. Hussein, Senior House Officer in Gland Clinic today. I'm talking to Miss Lisa.
Yes, I am.
Miss Lisa, we're here with you to discuss some issue related to your health condition. Is that okay?
Sure, doctor.
Miss Lisa, do you need anybody to attend this meeting with you to support
No,
you?
no, doctor. Thank you. I can do alone.
Okay, Miss Lisa, how do you know about your health condition so far?
Doctor, I am that kind of people has the disease. It's called diabetes for a long time now. For 20 years, I'm suffering because of this diabetes. I did everything to control this diabetes. I used a diet regime. I used exercise regime. I'm going to the gym. I'm doing my best, doctor, to control the diabetes. I don't know what happened, doctor. Why they brought me to you today and they told me that I had some abnormal movement. What happened, doctor?
I highly appreciate your concern. I'm sorry for what happened to you, Miss Lisa, and thank you for sharing this information with me. Miss Lisa, yes, you have this high blood sugar for a long time and suffering from this shaking of your bodies. And uh, we did for you some blood tests and revealed that you have condition called hypoglycemia. Have you ever heard about this?
Yes, doctor, I know this complication whenever I took the insulin overdose. But why it happened with me, doctor? I am taking my insulin in the proper way. my compliance to the insulin also in the proper way. Why I got this hypoglycemia now?
Uh, Miss Lisa, your concern is valid. Let me to explain to you hypoglycemia of unawareness. It is a medical condition in which there is low blood sugar without symptoms. In normal situation, our when suffering from this low blood sugar, uh, uh, our, our body gives us alarming symptoms like shaking hands, sweating, or racing heartbeats to alarm us there is something wrong, like this low blood sugar. But in your case, unfortunately, this alarming symptoms not happen because of long. There's many reasons for this hypoglycemia of unawareness, like long-standing high blood sugar or restricted uh, glycemic control also, as in your case. Did you get me?
Yes, doctor, but you are the one also, doctor, told me to be strict, control my diabetes. I'm trying to do my best to be controlling my diabetes. I'm afraid of the complication, doctor, of high blood sugar. Now you told me it's a strict control. What to do? Either to be hyper or to be like this?
Uh,
I'm
I
confused,
highly,
doctor.
I highly appreciate your concern, Miss Lisa. Yes, uh, uh, practicing exercise and one of plan of treatment of this high blood sugar, uh, but also uh, restricted control of blood sugar can lead to a complication like this hypoglycemia of unawareness. So we need from you to lose this restricted control to prevent this hypoglycemia to happen again, because has a serious complication like this shaking of your bodies and even loss of consciousness and coma. I'm so sorry to tell you that, Miss Lisa.
Okay, doctor. Thank you for alarming me and warning me. So what to do, doctor?
Okay. Yes, the treatment of this condition uh, is referring you to a group of specialists from this high blood sugar doctor and dietitian and exercise trainer specialist and specialized staff nurse to give you a proper plan of treatment. Did you get me, Miss Lisa?
Yeah, doctor, I agree
Uh,
for that. Yes.
yes, the treatment is losing of this uh, tight blood sugar control, and also we will give you uh, some advices like you take with you some sugar or sweets in case that if you have any symptoms or like hand shaking or sweating, you can take this sugar or sweets to correct your blood sugar level. Also, we will give you injection uh, and train your relatives in case that if have this condition like body shaking or loss of consciousness, they can give this injection in your muscles and bring you to a hospital. Is that
Thank you,
okay?
doctor. Okay,
Mm.
doctor. I will do anything, doctor, to be safe.
Yeah. Thank you for this cooperation. Also, uh, are you? I want to ask you some question. Are you driving?
Yes. Yes, doctor. This is one of my major problem in the life. I am dependent on my car, doctor. every now and then. And now I hear that they will suspend my driving license.
I'm so sorry for what happened. And your concern is valid, Miss Lisa. Yes, because of this hypoglycemia of unawareness, it is dangerous for you and for other when you are driving. In case that you get this condition and lost your consciousness, you can be you will be dangerous this in dangerous situation for you and other in the road. I think you don't harm yourself or other.
Yeah, sure, doctor. But for how long, doctor? I want to resume my activity as soon as possible.
Mhm. I highly appreciate your concern, Miss Lisa. Yes, to be honest with you, I will check my senior and I will update you by duration for this suspension of your license before you leave the clinic. Is that okay?
Okay, doctor. Yeah, sure,
Uh,
doctor. Thank you.
okay. Do you smoke?
No, doctor, I am not smoking.
Drink alcohol?
Yes, doctor. Yes, I am drinking art.
Mm. I I advise you to stop alcohol because this one of risk of this condition, hypoglycemia of unawareness. If you don't mind, I will help you and refer you to clinic that to help you regarding this alcohol to stop alcohol.
Okay.
Is that okay?
Yeah,
Okay.
doctor, if it will
What do
help
you do
you.
for a living, Miss Lisa?
Yes, doctor, I am a banker, working in the bank.
How much this condition affect your job
Yes,
and daily
too much,
activities? Mm,
too much, doctor. I am worried now to have this attack in the work and to be happen with my friends, and I will be embarrassed to have this attack while sitting in the office.
I highly appreciate your concern. I'm so sorry. Miss Lisa, I will refer you to a occupational health officer and social workers to help you regarding these issues.
Okay,
Also,
doctor.
okay. Uh, 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 who brought you to a hospital?
Yeah, my partner.
Mhm. He can drop you to home.
Yes, doctor. Okay.
Okay, that is good. Also, I am going to give you some brochures and website to read more about this condition and our contact
Okay.
number of our clinic. If you have any question and queries, you can contact us anytime, Miss Lisa.
Okay.
Do you have any other concern?
Thank you, doctor.
Thank
Time is
you.
up. Yeah, time is up. Thank you, Miss Dr. Mahmoud. Perfect. Really, really, really perfect. You did it in the proper way. Actually, I don't have comment to be as negative feedback. You did it in the good way. Uh, my comment will be only to how to do it to others for the teaching. I mean, how to do the you did it well, but just we'll start the missing point, what you missed, and I will tell you the point that missing or missed by you. Starting from, let's bring the communication, the scenario. Starting from the confirmation, you asked me the name only, you didn't confirm the age. You told me you're Miss Lisa, but you didn't ask me the age. Okay. And you asked me if you want anyone to. Yes, okay, you can ask. For the idea about the disease, you asked me, and I told you, I give you the idea, and I give you that I am really strict controlling my diabetes or blood sugar. The expectation you missed, what you expect, you can ask me, and I will tell you that I expect I will be fine within days, and this attack will not happen again. Although there is many reasons behind having this unawareness hypoglycemia. And you catch one of them, which is alcohol, plus, as you said, the diet control. And if you ask me more about exercise, yes, I told you I'm going to the gym. Sometimes I'm not taking my breakfast. I took my insulin, but without breakfast. So I'm compliant to the insulin, but sometimes I'm not taking the meals. And the other reason is alcohol. And the third one, the exercise, doing exercise. So taking insulin without meal, doing exercise without getting my meal. And the third reason here was the alcohol intake. So collecting all these together will be the reason of having an awareness hypoglycemia. Okay, so you did it well. Let's continue the comment for the expectation. Then you start to explain what the meaning of an awareness hypoglycemia. You explain it very well. No jargon, all simple words you used. Yeah, it happened when your body being strict control in blood sugar, and you will lose the alarming or warning sign for being hypoglycemic because of being on the strict target blood sugar level. So the alarming and warning sign for being hypoglycemic, I'm already losing them because of the diet control or the long-term diet control. Why the diet control? I told you the reason. And with the time, you give me alarm or warning that you might even be in coma. You can say also it will threaten your life, just to be alarming here for something very serious. Okay. Then yes, but try to be in communication more. Following, are you following me? Are you getting me? Are you understanding me? I mean, talk as long as you want, but don't talk long without asking her following. Okay. Then the driving, yes, it's one of my concern, and you answer in perfect and diplomatic way that you will ask your senior. Even you can reassure here that whenever the reason of having this hypoglycemic attack will be solved, I can or she can resume her driving. And but the answer was perfect to refer her to your senior or consultant, and he will address or he will give her or you will update her at the clinic time. It's accepted to say that as well. But the good answer, once we figure out the reason of being hypoglycemic and we solve this problem, you can resume your driving. Then, yeah, the alcohol, you ask for other reason for being hypoglycemic, risk or having the risk to be in hypoglycemic side. And yes, but you didn't ask me the amount, how many, and over, and per week, I mean. Even 5 unit, you will tell me don't drink. Even 1 unit, 2 units, it's not not a matter of number. It's a matter of drug intake. Sorry, alcohol intake, which is a risk for having this an awareness hypoglycemia. In general, hypoglycemia, and specifically in this patient, an awareness hypoglycemia. Then you offer me the leaflet brochure website about the unawareness hypoglycemic. And the good thing also perfect when you offer me a group of specialists, including the dietitian, the also trainer, exercise trainer, and my GP, and you can add also our team. Why? To educate you how to do your regime, the diet regime, the exercise regime, and not to be in this complication again. And the closure, yeah, you give me the little brochure website and contact number for any inquiry. For me, if you do in this scenario in this way in the exam, you will pass your station. Thank you, Dr. Mahmoud, for doing the case. Actually, one of the common scenario and difficult to address. Some people are confused between this and awareness hypoglycemia and the hypoglycemia. As you did, being a strict control and figure out the reason behind that and try to solve it and try to involve the team concerned to this complication, and that's it. With follow up, of course, you will tell her we will follow up you and we'll give you next meeting and next appointment to have um, a result or to have some follow up checkup for your blood sugar and hemoglobin A1C. Yeah, but what you did is, I agree, is full uh, confidence and it's satisfying for the getting the mark. Okay, any question? Thank you very much. Okay, thank you, Dr. Mahmoud. I'm sorry to miss this session today. Allah, I have some circumstances. I'm in the airport now, but it's okay. We did at least one case, and I will share the reports to be beneficial for all.
Thank
Any
you.
question?
Thank you very much.
Thank you, Dr. Habib. Thank you, Dr. Roda. I know you tried to do it. Anyway, we'll have we can repeat the scenario if someone interested for another day. Also, the record will be there. It's because it's very common scenario. Okay, thank you, Dr. Roda. Thank you all. Thank you, Dr. Habib. You are talking, but I can't hear you. There's some problem in your mic. Yes,
Okay,
now
okay.
I can. Yes,
Dr. Basim, there is
yes,
any difference in communication in hypoglycemia with due to another cause, such as insulinoma? Any difference?
yeah, this is different, totally different. Yes. Insulinoma, there is a reason behind being hypoglycemia, from a tumor or cancer.
Yes, yes, yes.
Yeah,
Pancreatic
secreting insulin. Yeah, this is another
yes.
category, and you will address here in another way.
This is related to insulin only in this scenario.
This
Hypoglycemia
is
related to
related,
insulin.
which hypoglycemia? Unawareness?
Uh, in this scenario, I mean in this scenario.
This scenario
Al-
different. Yeah, this scenario
yes,
is
yes.
related to, yeah, a long-term strict control of blood sugar, either by doing excess exercise, not eating well, and trying to be in the target hemoglobin A1C of 6 or less. With the long term, this will lead to an awareness hypoglycemia. Even the warning signs, which is shaking or, as Dr. Mahmoud said, sweating or shaking of the hands or palpitation or hunger pain, will be lost. And the patient will have the convulsion with loss of consciousness, and the one will discover him either her friends or her family, and so on. Yeah, one point very important missed done by Dr. Mahmoud, the glucagon pen and the candy and the sweat to be with hair, plus the
Okay.
bracelet, of course. Yes, and also you can add one important point. Please tell your friends and inform them, your friends, your family, that you are at risk of being hypoglycemic, and teach them. You can tell them, if you can invite them to teach them how to deal with you in these circumstances. It might happen at work, it might happen at home, and we should tell them and educate them how to deal with you in this time. It's very important to be in this scheme of this scenario. Dr.
I
Mahmoud did it.
misunderstand. I misunderstand scenario. I understand this hypoglycemia related to insulin. It's insulin.
No, no, it's not insulin.
Yes, yes.
Yeah, patient is taking the insulin compliantly, but she is strict for in the diet. She's
Okay.
doing exercise more than required. Yeah, she's afraid to be in hyperglycemic side, That's why she's trying to do more burning, more exercise. The meal is not adequate or taking less meal or not compliant to the meal. Plus the alcohol, one of the reason of unawareness hypoglycemia.
Elevated.
You got it now? Yeah. So to be with her family education and her friends, how to manage this problem if happened. Sweet or candy to be given to her, or the glucagon pen, as Dr. Mahmoud said. Okay, CGM device. I think this device for checking the blood sugar, right? Dr. Roda, you can talk. Continuous, yes. Continuous glucose,
Yes, yes,
glucose,
it's for measuring.
continuous glucose monitor. Yeah, it's under the skin, right? It was called labor, right? Labor. Someone
I'm
shared.
not sure. Yes.
Yeah, labor. They shared it in the group before. It was named as labor. It's a subcutaneous injection or put under the skin, and
Yeah,
it's yes,
and
continuous
it sends
monitor.
like alarm to the mobile phone.
Yes, exactly. Yes, to the phone, and she will alarm her by application. Yes, you're right. It's
Yeah.
called liver.
Oh,
Yeah,
oh,
I can share it again for more information.
yes, yes, please.
Yeah. Okay. Thank you, Dr. Roda. Thank
Welcome.
you, Dr. Hadid. Any other question? Any concern? Any comment? Yeah, it was just a short station to not to miss this day, because every day, every case will learn from. Even the situation you are in might make this case like for example, if you do a case in certain place and you remember the case by this place, and it will come to you in the exam, you remember everything you did in this case. I believe if you do such scenario by this way, you will never miss what you did in the case. Okay, so you will remember this case by this short station, which we didn't do before. It's first time to do a short station, but the scenario will be fixed with your in your mind. We did it in a short station, only this case, and it's a common one. I hope all understand this case, and if it comes to the exam or in the exam, it will be done perfectly as Dr. Mahmoud did. Okay, thank you. Labor, yes, this is the labor. Thank you, Dr. Hida. You came on time. Thanks, Dr. Maher. What about medical bracelet? Yes, I said it. She should wear it. Okay. Hypoglycemia, one of the patient should wear the bracelet along with Addison and I guess the epilepsy. But the most important, the hypoglycemia, diabetes, I mean, and the Addison disease. Thank you, Dr. Ihda. You can share this YouTube to also the, yeah, thank you, Dr. Hadi. To the WhatsApp group, Dr. Ihda, please. 20 years did consider as long time. Yes, but it's not a matter of long-term diabetes. It's a matter of long-term strict glucose control. You mean the autonomic neuropathy? Yes, one of the reasons. Yes, autonomic neuropathy for the long term. Yes, the patient will have autonomic neuropathy, and autonomic neuropathy also one of the reasons behind this unawareness hypoglycemia. Yeah, it could be like this. But the main issue is being control or tight control of blood sugar for a long time. Okay. Any other question? Any other comment? Beta blocker. Yes, one of the reason if the patient taking beta blocker, but it's not mentioned in the scenario, so you will not ask as well. Even he will take, you will not take history if he is taking or no. but alcohol allowed to take, and control of the exercise, the diet. It's not a, and even if you want to do, you can do it not as a question, you can do it as enumeration of the reason of unawareness hypoglycemia. You can say, yes, some drugs like beta blocker can lead to, without taking history or asking here, did you take or have you ever take? Don't ask any question in the communication. You can enumerate the causes and as warning the patient or the surrogate that this one could be the reason. And he might tell you, yes, I am on medication. So you didn't, you did it in the indirect way, and you will not minus, or they will not minus you as a question and taking history. Okay, this is a smart way to get positive drug history without asking a question. Just enumerate, and the surrogate or patient will tell you, yes, I have taken this medication or whatever. Yes. Any question? Thank you, Dr. Roda. Any question? Any question, any comment, any concern? Dr. Hida, please don't forget to share the liver YouTube in the WhatsApp group. Okay. If no more question, we can end this session. Thank you for attending this. Sorry. Thank you for attending this short session. I hope that you got the benefit from this session and this case scenario. And we'll see you, inshallah, on Saturday. Yeah, thank you, Dr. Hina. Yeah, see you on Saturday. And good luck. Good night. Assalamu alaikum wa rahmatullahi wa barakatuh.